Good afternoon, everybody, and welcome to the last session of the day, which is on a super important subject, creating a robust mental health management system. Before I hand you over to Duncan, just a reminder, everybody, that all the sessions are recorded, so you are able to pop back to them at any time on demand. And very shortly, I'm going to be handing you to Duncan. We're in super great hands here. He's got a wealth of experience in this area, and I know we're going to get lots of great advice and guidance. He is a recognised thought leader in the field of occupational safety and health, and is a regular guest speaker at conferences and a published author on this subject, including a book and many articles, blogs and columns. His experience includes safety in many different industrial sectors and government and public organisations in the UK and other countries. And this includes different sectors: agriculture, construction, retail, distribution, healthcare, charities, uniform public services and manufacturing. And Duncan is presently the head of advice and practice for the Institution of Occupational Safety and Health, where he's also a chartered fellow. And Duncan's IOSH role includes managing IOSH's research function, its thought leadership and practice application teams. So I know we're in for a great final session. Duncan, thank you so much for joining us, and over to you.
Thank you very much, Dee. So yes, hello everybody, good afternoon. Thank you very much for the invitation today and the opportunity to talk about what is a very important subject, and certainly one of our key themes at IOSH this year and indeed into the foreseeable future. For those of you who don't know who IOSH are, we're the largest membership body in the world now for occupational safety and health practitioners. We have around 52,000 members, and our members stretch across 130 countries across the world. So we are in a position to be able to not only help our members, but also we have considerable influence with international bodies like the World Health Organization, International Labour Organization and such like, setting the right framework really for our members to be able to work in. So on to today's topic. I'm going to cover 4 different areas, and I'm very conscious with the audience being at probably different stages of maturity in their examination of mental health in the workplace, well-being in general. So I'm going to have a little look at IOSH research during this presentation. So we're going to have a look at what that research has actually told us in terms of designing a mental health management system. We're going to look at what the different aspects of that system might look at. We're going to look at common mistakes because there are mistakes being made in this area, and considerations that need to be made. So that's where I think most learning can come from. And I'm also going to finish off by looking at, in the UK, the legal position of mental health first aiders. That's something which is an emerging discussion amongst lawyers at the moment. So I just wanted to shed a little bit of light on that too. So a few statistics to start. So certainly since COVID-19, we have been gathering momentum worldwide around mental health, probably spurred on by the fact that COVID-19 had such a radical change in our society, in our working practices and such like. And it also, of course, in the aftermath of that, is very strange for individuals to be suddenly locked down in countries like UK, who locked people in their own homes, essentially, to be able to stop the spread of that disease. And that started to have an effect on people's mental health and such like. And as we came out of COVID-19, people very much, workplaces very much look to the occupational safety and health profession to help them climb out of, to deal with COVID-19 at the time, and then to deal with the aftermath of COVID-19. And that has certainly shifted the boundaries within occupational safety and health, that practitioners such as myself now very much start to embrace well-being and mental health as part of our portfolio. In fact, IOSH did a survey of its members last year, and 75% of its members actually said, yes, well-being is part of my portfolio, it is part of my responsibility, and I need to be moving forward with it. So it's a considerable shift in boundaries. But I'm also conscious from looking back over my career that when I started, it was very much seen as occupational health territory rather than occupational safety and health territory. So that has moved considerably, and as I say, I'll be covering some of the aspects of how we collaborate as we move through this presentation. So good mental health is essential to well-being. I think that's an unequivocal truth. And if you look at the UN Sustainability Development Goals, you know, they talk about fulfilling jobs as being an important aspect of achieving social sustainability. And that's important. It's important that we give people the opportunity to be able to develop purpose and to achieve things. And if they have purpose and they can achieve things, that is the pathway towards good mental health. And of course, it goes hand in hand and in alignment with what organizations want from their workers, which is to have a productive workforce moving forward. So well-being, mental health, you know, it is so intertwined with how we run our businesses, how as workers we approach our work, how as managers we manage the workers moving forward, that it's fundamental. So it's rather surprising when you look across many organizations and you say, well, what do you do about mental health? And they say, well, you know, we've got an employee assistance program. So if a worker is not feeling too good and is starting to feel anxious, depressed, or whatever, then they can ring up somebody and they can speak to somebody confidentially and so on and so forth. Yeah, that's really important. But what do you do before that? You know, and they say, well, yeah, hang on a second, but we are also training mental health first aiders, or as some organizations prefer to call them, peer-to-peer supporters. Again, great, but you have to kind of, same with the EAP, you have to wait for people to feel as though they're in a bad position and come forward before you actually help them. Now, if you think about that, employee assistance programs and mental health first aiders are recovery controls. They are not preventative controls. So if mental health is becoming a fundamental aspect of an occupational safety and health practitioner's portfolio, then we have to start looking at those difficult challenges that are associated with preventing people becoming anxious and depressed in the workplace in the first place. You know, we have to concentrate much more on prevention controls rather than the more easier end of the spectrum. I'm not saying that EAP programs and mental health first aiders are, you know, you shouldn't bother with those things. Of course I'm not. But what I'm saying is they're only part of the picture, and they give people false hope because they think that they're doing something about it, when actually the more important and challenging work to be done is how you prevent people getting into that poor mental health space in the first place. So well-being, let's just pause there for a second and I'll show you this diagram. You know, this was developed by a colleague of mine in my team, Dr. Chris Davis, and he started to think about the spectrum of well-being and what that might mean. And the more that we started to think about it and dig into it, the more this categorization started to make some sort of sense to us. So that there is a sense of organizational well-being, you know, so that's the overall culture. It's about your EDI processes, your performance, and so on and so forth. There is operational well-being. So it's the kind of things that prevent the psychological risk. It's the kind of things that enables us to respond to situations. It enables us to put remediation in place and so on and so forth. So those are important aspects of any safety management system, as we all know. We look at holistic well-being, you know, because there's kind of the day-to-day stuff, if you like. It is my operational well-being, but there's holistic well-being as too. That's how we engage with people, how satisfied they feel, whether they understand mental health, that they're literate in that particular area, the kind of relationships that are in place, and how that relates back to culture once more, maybe. And then, of course, you can't divorce the person from the workplace, and the person in his own right, his or her own right, they also have things going on outside of the workplace. So, it's their life choices, their sleep patterns, their family arrangements, the challenges that they're having maybe with personal finance or whatever. There is another aspect here that affects people's minds, because let's face it, you don't have two brains, and you don't come to work, take out your home brain and then put in your work brain, and then at the end of the day take out your work brain and put back your life brain, and it's the same brain. So inevitably, if we've got issues in one, it's going to spill over to the issues in the other. So this is a real complex picture, and it's one worthwhile bearing in mind and digging into, because as you start to think about these different boxes, it spins you off in different directions in terms of what we might need to look at and consider in designing a safety management system in this area. So culture, job design, worker satisfaction, relationships, operational performance, reputation of the business, all of those kind of things are going to be affected by the various different boxes in these particular categories. Back in January this year, I went to the Wellbeing Conference at Manchester, and I heard a person from the HSE, Dr. Ed Corbett, talking. And he talked about three aspects of mental health management that I thought were quite interesting, not from the point of view necessarily of what he was saying, but in the point of view of trying to develop a strategy to move forward and to enhance your organization's performance around this. So he talked about the three categories of prevention, coping and adaptation, and integration. So let's talk about prevention first. I mentioned it earlier on. It is the primary thing, the primary responsibility of occupational safety and health practitioners, that we must drive our organizations to prevent rather than, to be preventative in nature. It is the primary policy, it is the primary principle of our profession, but it's probably the most difficult to achieve in this particular area. Not least because, I spent a long time in retail, and it was very stark in retail that one person's stressor is another person's motivator. So if I looked into the marketing department in the John Lewis partnership, there were individuals there who actually thrived on stress, that the competition they had with other people, the idea that you've got to get something in place for next season that is going to wow your customers and differentiate you against your competitors gave people a real buzz and a real way forward. Yet there were other people in the organization, such as people working at the checkouts maybe, or in distribution centers, that would be alien to them. If they would place them in that kind of an environment, even if they had the right skills, as a personality, they might not be able to deal with them terribly well. So one of the first things to think about, really, it goes right back to, are you recruiting the right people with the right skills and the right outlook on life into the correct roles? That's quite fundamental. People don't often talk about that. They don't often think about that. But are you well suited to the environment that you're in? And you sometimes hear managers talking about, oh, well, so-and-so is a really good guy, but they don't really cope with what we're asking them to do. That kind of a conversation makes you think, well, did they recruit the wrong person then? Is that person in the wrong role within the organization? So fundamentally, any kind of well-being program, any kind of mental health management system has to start with, who are you recruiting? How are you recruiting them? Are they suited to the roles? Do they have the right skills and the right approach to be able to deal with those kinds of things? And then, of course, in the wider aspects of mental health management systems, prevention comes from understanding the stressors in the workplace. The HSE is very good at explaining what those stressors are, But when you go through the Health and Safety Executive's website, there's very little information there really on how to address each of those different stressors in the workplace. So one of the things that we have to do is look at that stressor list and say, how do they apply in my organization? How do they manifest themselves in my organization? Because it'll be different for everybody. Every organization is different in my experience. So you need to look at those and you need to interpret them to your local circumstances before you even get anywhere close to, okay, what can we do about controlling those stressors, about mitigating those risks? So prevention, absolutely has got to be first and foremost, and that can be quite wide-ranging. Coping and adaptation next. We do have, as I explained on the previous slide, organizational resilience and individual resilience to talk about. And where does resilience come from? Well, arguably one of the primary sources is from education. So one of the things that we need to do is to ensure that our organizations and the individuals within them are actually literate in the sense of being able to talk about mental health, and that mental health is actually destigmatized. Not just for the workers, but let's face it, people in very senior position often go unnoticed because it's thought, well, they're the boss and that they should be okay, they know what they're doing, kind of thing, and that they should be able to cope with that. As all of those kinds of things start to come out, but actually they're the people sometimes who are most vulnerable, because unlike a worker, they have less opportunity to turn to others and be open about the fact that they're having mental health difficulties. So there's a lot of stigmatization that surrounds this, as we all know, that we need to be able to work on, and we need to do away with as best we can. So when we educate people, we educate managers and we educate workers, and we need to educate them about the triggers for poor mental health. So we need to talk about those stressors from the HSE list. We need to talk about our interpretation of and contextualize them within our workplaces so that people can connect with that kind of theoretical approach and make it real for themselves in terms of what that actually means to me. Because it's not just managers who need to be able to watch for the triggers for poor mental health. It is also the workers who need to look for it too. Because quite often, workers these days are working in remote circumstances, like I do, or they're working in circumstances where they may not be seeing other people during their working time. So you think about a crane driver, for example, or a security guard. They might be in the same workplace as you, but actually in reality they're working alone rather than anything else. So we do need people to be able to understand that. And we also not only need to educate so that they learn, but we also need to educate so that it enriches our monitoring systems. The key to any knowledge is a word. So if I said risk to you, then you would immediately your mind would start to think about, well, what does risk mean? And it's all of these elements and so on and so forth. So a word is a key that enables you to access knowledge. So if we're going to have to set up a vocabulary within an organization of the right kind of mental health words that people can attach to and understand and use in a correct fashion. The other thing about coping and adaptation, of course, is being a learning organization. So one of the things that we need, and we have in any other kind of a management system, is a reporting and an investigation process. Now, therein, we hit some barriers sometimes because people challenge us from the point of view of confidentiality. So if somebody comes in confidence to say, I've got a problem at home, they don't really want that shared all over the business, that they've got marital problems or financial concerns or whatever else it might be. So there are some real challenges here around confidentiality, but at the same time, we need to understand that. We need to be able to extract the learning from that case and transfer that learning into the organization in a way which enables us to be able to enhance our systems. So while confidentiality needs to be respected, we have to find ways around how we can nonetheless perhaps by making the cases anonymous, of course, but how we can still learn from those cases and learn as an organization to move forward, because we need to adapt, we need to enhance, and we need to improve. And we can only do that if we examine the reports that we're getting and we investigate these kinds of situations. Oh, sorry, I went too early. I didn't talk about integration. Let me talk about integration. So if you're an organization whose primary focus is on production and performance, and occupational safety and health is secondary to that, then you are going to be limited in your success with developing a mental health management system. I'm not saying necessarily that occupational safety and health should be number one, but it should be fully integrated and part of that productive aspect, that productive conversation that's going on in your organizations. So we have to start to routinely consider the mental health impacts of our business decision-making processes. We need to be fluid and highly adaptive in terms of how we approach things. So I can tell you again from working in retail, there were 2 intensive periods of work during the year. The first one was around Easter time, because everybody is getting ready for, Easter holidays and all the rest of it. And the second one, of course, is Christmas. And I can tell you at Christmas, the organization and the way that it operates looks very, very different to the other times of the year. So we can actually predict those kinds of business cycles, and we can actually predict when people might be under more pressure than at other times. So let's prepare for that better. We know that's going to happen. Then let's think about how we can prepare people going into those intensive working periods. Or if we're looking at a project and we're looking at the impact of that project from an operational point of view, surely in the same breath, we then ought to say, and the people working on this project might therefore be challenged from a mental health point of view, because it's going to be an intense work period, or they're going to be doing things which they've never done before, that we're stretching their skill sets maybe, and so on and so forth. So if we are going to have an effective mental health management system, we have to be fully integrated into that decision-making model within the organization. Otherwise, it isn't going to work. Secondly, I would say in integration, don't forget about your policy positions. And I'm not just talking about your occupational safety and health policy here, but what about the dignity at work and the violence and aggression? Even things like your recruitment policy, your procurement policy, your finance policy, all of the policies that you have within your organization, if you think about it, have some kind of an impact or an influence on the mental health of the workers within your organization. So if you're going to be truly joined up on this, if you're going to be truly integrated, then you need to review that policy portfolio and say, does our EDI policy marry up with our occupational safety and health policy and our finance policy and so on and so forth? Do we have the same tone in there? Do we have the same kind of arrangements in there? Do we have the links between these policy areas really clear in our minds as we move forward? And I think some organizations that I've talked to recently, they're stretching this even further, because they're not just talking about improving the integration within their own organization, but they're also talking about improving the integration with their contractors and their supply chains. Because let's face it, market forces should not be allowed to undermine the standards of health and safety performance. So a few IOSH studies that we've done. So as you heard at the introduction, my team is responsible for commissioning academic research in part, as well as translating it into practice. So let me talk to you about 2 or 3 of our more recent studies that we've done. So in 2017, we commissioned Swansea University to look at the shift work effect on health. And not surprisingly, what they came back and gave us evidence for was that shift work can actually increase levels of fatigue, and it can increase feelings of social isolation as well. It's because you're working at night, let's say, which means you can't meet your daytime friends. because they're out celebrating while you're at work, and then they're at work while you're asleep, kind of thing. They also found during that study that food, the quality of food that people are eating during their shifts, actually has a real influence on their well-being, and having appropriate breaks, not just breaks within the shift, but breaks from the shift. So, having periods where they're not working at night, but working in other occasions, other times of the day. One of the most surprising things that came out of this was social opportunities. Some of the better organizations in the study, actually, they had a lower stress rate in their organization because they allowed the shifts to socialize with themselves. So they had social committees who actually organized those kinds of events at abnormal times to the rest of us who work normal shifts, maybe, but during the day for those people and such like, and where they were playing football, or they had bingo nights or whatever else it might be, enabled them to come together and build that social atmosphere. So that was quite interesting. Our next study that I'd like to talk about is from the University of Limerick in 2018, the Irish Workplace Behaviour Study. And again, not surprisingly, they found that the causes of anxiety and depression was very much aligned with unreasonable management, incivility, lack of respect, and, interestingly, observing poor behavior. So they see poor behavior between two individuals, a manager and another person, or something of that nature. And then they don't see that there was any corrective action taken on the individuals involved. And because they saw the poor event and they didn't see any kind of proper follow-up and addressing of that can start to lead people on a spiral downwards. So that talks to us very loudly about ensuring consistency of management throughout our organization. So the competency of managers that very much comes into frame in this particular study. What are their skill sets, their leadership skills, their management skills, their ability to implement policy effectively, those kinds of things. The third study I'll talk about here is from Cardiff University in 2021, Seafarers' Mental Health and Wellbeing. And they echoed previous studies that we've done in terms of poor food, long hours, lack of leave, limited access to their families, poor recreation facilities, officious management. All of those things were very much leading to anxiety, depression, exhaustion, and burnout. And again, that wasn't just among the sailors, but it was also among the officers in the Merchant Navy as well. So, there's that kind of isolation thing again. And I think there's a bit of a thread through these three studies, which is the thread of humanity. At the end of the day, we're humans, and humans are social animals. And, while we're at work to do a job, I get that. If we can do something to enhance the social ability within an organization, that will go a long way towards improving matters for people, making the workplace enjoyable, and making them less susceptible to poor mental health. So let's look at the individual for a second. So, I tip my hat to my late dear friend Chris German here for this particular model. He talked about an elastic band, and he said, look, most people are healthy, and occasionally they might get challenged and they go, oh, blimey, that was a bit of a bad day, but they're coping, right? And they kind of flex between those two areas. Occasionally we might push them too far, and we push them into, I'm really not coping at all here. I'm struggling with this. If we don't do anything at that stage, because it's getting a little bit too late at that stage, then they will inevitably tip over into the other area of being unwell. And that's when they come forward and go, oh, I need a few days off work, or, I need to see a mental health first aider, or I need help. So we've already failed because we've prevented them getting that far. So we need to be when we're in the healthy zone, we need to have better perception. When we're in the coping zone, we need to be able to recognize those triggers. When we see people struggling, we need to intervene at that point. Otherwise, they are going to become unwell. And if they do become unwell, then we need to help them from treatment and return to work after their treatment, and manage that, which I'll come on to in a little while. So we need to control workloads. We need to signpost people to where they can get help. We need to enable people to be able to cope with the situation when they are struggling. If we don't do that, regardless of whether it's a work-related stress or whether it's a home-related stress, if we recognize people in that condition and we do nothing, even if it's home-related stress, then it could be found that we have contributory negligence if we don't assist those people to get themselves to a better position. So let me talk about mental health first aiders. With Nottingham University in 2019, we published an academic paper which looked at the limitations of mental health first aiders, which was, there were 4 key areas discussed within this paper. First of all, if we're going to have them, we need a clear rationale for them. So what are they there for? Whereabouts do they fit in our system? How are they selected? How are they trained? How do we make sure that those people who do volunteer for this position have mutual support mechanisms and even access to a specialist, because they potentially can hear some very harrowing stories, and it can affect them as humans too. So we need to think about that. Secondly, raising awareness. Interestingly, what they found was that having mental health first aiders, there was some colloquial evidence that it helped to improve the language around mental health within organisations. It helped to raise awareness, and there was some claims that it helped to destigmatise mental health in the workplace. But actually, there wasn't any research evidence, and there still is none to date, that mental health first aiders are a cost-effective intervention. So that's quite interesting, considering that many people are heading in this direction. Another finding, the third finding of this study, was that the people who studied, the organisations that were studied, were very poor at measuring the impact of their intervention. That they were quite poor at establishing the boundaries of the role and making sure that their strategy was consistent in terms of its relevancy, the training associated with it, how it operated, and so on and so forth. So within different organisations, essentially what they're saying is nobody really is at the norm yet. There isn't a norm. Everybody is doing it differently and finding their own ways and things. So bearing in mind that was 2019, I think things might have moved on slightly since then, but nonetheless, that was the finding. And then the other question, the fourth question they raised was, who do you choose to become a mental health first aider? Because not everybody is suited to it. So if that person comes forward who's not suited to it, how do you turn them down? It raises some new issues around it. What if a person comes forward who's inappropriate to be in that role, who, for whatever reason, whether that's a work reason, whether that's a personal experience reason, whether it's an approach reason or whatever. So there has to be some kind of selection process. A lot of people employ trainers in this region to say, okay, well, while you're training these individuals, we'll train anybody who comes forward, but you need to help us at the end of it, saying who is an appropriate selection and who isn't. So there's kind of like a passing and at the end of the training, which enabled people to move on to the next thing. Now, I was going to talk about their legal position. Now, this is quite interesting. Now, there is a case, Walker versus Northumberland County Council, which I think was about 20 years ago, something like that. But anyway, there was Mr. Walker was a social worker who claimed that he had an abnormal workload, too much pressure, had a mental breakdown, and time off work. When he came back to work, he said, look, I've got too much work, you need to do something about it. Management said, yes, absolutely, we'll do something about it. Nothing happened. And then he had a second nervous breakdown as a result of the workload. And the interesting thing in that case was that the judge's finding was the first mental breakdown was not reasonably foreseeable because he hadn't told the organisation. And the second one was, and therefore they found in Mr. Walker's favour on that occasion. Now, that sat with us for a number of years. And of course, then along comes the mental health first aider. And if you think about it for a second, the company actually puts a selection process in place. The company appoints a mental health first aider into position. The company tells them what that role is and what needs to be done, gives them the resources, time, money, whatever it might be, to be able to carry out that role. So in that sense, can you therefore argue that the mental health first aider is acting as a company agent? Yet many organizations say, no, the mental health first aider is the companion to the workforce. They just deal with the workforce and they help those people. It's all anonymous and it's all about the individual and so on and so forth. But actually, there is a legal argument there that's not been tested yet to say, well, in that capacity, you have appointed them. They are a company agent. So if you go back to that Walker versus Northumberland County Council finding, if a person comes forward to a mental health first aider and says, I'm stressed, in part it's due to work, is that the date of knowledge for the organisation? So do we have to have some kind of, back to my earlier point, reporting mechanism, an investigation mechanism, and a mechanism to learn from these cases to enable us to move forward and so on? I think we do. Yes, we have to respect confidentiality, but I think there is an aspect to the mental health first aiders role that hasn't been explored fully yet. So moving on to return to work. We did some work with Tilburg University, a couple of studies actually. The first one was in 2017, the second one I think was 2020, I think. But we looked at return to work after common mental disorders and such like. And some of the findings in that was the very best place for people to recover was in the workplace. You have to be careful about it. There's lots to think about in terms of collaborating with that person's GP, with the individual, with maybe mental health specialists who may be external to your organisation, with local manager, and so on and so forth. So there needs to be a quite in-depth review of how we're going to help this individual come back and survive in the workplace, and more often than not on a phased return. But when we do that, the chances of that person making a full recovery is actually it goes up tenfold. It becomes a situation where an individual will be able to build their loyalty for their organizations. A lot of people have been through this process. They find themselves very loyal to their employer when they've been helped through a very difficult period in their life. They feel supported and such like. That very much contributes to a positive culture, working culture within an organization. So it's dependent on the manager making sure that all the factors are properly addressed, that they're working in a stigma-free environment, that there is the full cooperation across all these specialists and such like. And it does rely on the individual being quite self-aware, growing their self-aware, understanding their limits, having a supportive manager, making sure that they recover, they give them a chance themselves to recover properly as they go through. And the alternate to that is to say, no, don't come back to work until you're better, which some organizations do. Well, I'm sorry, but when people are on long-term sick, they get more and more divorced from the workplace, less and less confident about returning, and their symptoms often become much more chronic than when they first went sick. So all this study from Tilburg University actually shows us is the quicker we can get people to return to work, even in some small capacity, the better it is for that individual. So return to work systems need to be part of this mental health management system too. In short, coming to the end now, a lot of what I've been talking about today, it's not really new concept for the occupational safety and health professional, because they are elements of any kind of safety management system. How do you assess? How do you record? How do you build safe systems of work? How do you report? How do you investigate? How do you monitor? How do you review? All of those things are kind of wrapped up in how we govern this particular area. So governance and authentic leadership is really key. So having people at the top of the organization who very authentically talk about mental health and how important it is and how it contributes to the success of the organization. You know, successful organization is built upon successful individuals within it and such like. Then all of that is a really good message. And also getting that authentic leadership from directors to ask the right questions around, well, what is our system? What is that system actually working? What evidence have we got that that system is working? How can you validate these claims? You know, those kinds of governance questions from leaders are really quite important to push us on to higher standards, I think. And then when you look at the International Labour Organization and the World Health Organization and their guidance, you know, they again talk about having that leadership at their level within their organization, within any organization. They talk about investment. They talk about making sure that the rights of the individual, be it a worker or a manager or a director or whatever, that they're all properly understood and intertwined into this consideration. So there you go. Thank you very much for listening, especially being the last one on today. I hope you found something of value in there. I've done my best to try and range over what is a very wide and deep topic in certain areas. But thank you very much for listening. Dee.
Duncan, thank you so much. Wealth of information and guidance in there. Thank you so much for a great session. We've got just a few minutes left, so if you don't mind, there's just a few questions that have come in. I mean, a comment for me, it's great that you mentioned how important it is for a strategy to include everybody, including the senior management, the mental health first aiders, vulnerable people, absolutely everybody. And you just touched on it at the end there about the importance of authentic leadership, which is a real passion of mine. But there's a question here: how important is it that senior leaders lead by example? And what are some top must-dos for them and some top must-nots?
Oh, cracky. That's a good question. Yeah, I think some of the most, let me answer it this way. And I think some of the most powerful speakers that I've seen in conferences have been people in very senior positions within organizations who have had personal mental health challenges and have learned from that and move forward with it. You know, those kinds of people who understand that, I think they're very important within any organization, because it does give that level of authenticity within whatever is being discussed within the organization. You know, if they say, well, look, I'm a senior leader, but I'm still a human at the end of the day.
Yeah.
And I've had some difficulties, I've had some challenges, and I've had a pretty tough period, but I've done X, I've done Y, I've done Z, and this has helped me come back into the organization. And now I'm very much an advocate for helping others in similar situations. So, when you talk about authentic leadership, it's that authenticity, which is the real key aspect of this. It quite often in many organizations, for whatever the safety management system is, it can feel sometimes at the bottom of the pyramid that safety is done to you, So I think one of the other aspects of authentic leadership is asking the organization what it wants. And when you ask the organization, essentially what that means is you're asking the individuals within the organization, what do you want? And so we're back to that education point. We're back to that raising awareness point. But I think, for me, the most robust management systems that I've ever seen, and mental health management systems are no different in this respect, are there because they're partly designed by the people who then might need to use them at some point in the future, that they've got proper consultation, full consultation with the workers, with supervisors, which often, is the key role in terms of systems working or not, with middle managers, the squeezed middle, with senior managers and so on and so forth. It's got to be authentic for all, hasn't it, really? So I think, the top three things really would be tell the truth and be human, to make sure that you work very hard on that destigmatization and consult properly with people so that your system reflects their actual needs rather than their perceived needs.
Yeah, that's a great response. It's so powerful, isn't it? If you can get the leaders to be, admit the vulnerabilities, it creates that all important psychological safety. Now, thank you so much for that. We are running out of time. Just one last question, and this is really from me. What would you leave our audience with? What would be your call for action? Like you said at the beginning, there's people in different stages of their journey in health and safety, but if we can send people away at the end of this conference with one call for action, what would it be?
I think it's to change focus. This is a generalism, I know, but in general, the focus in organizations is on the recovery controls associated with mental health. And we need to be truer to our own profession and focus and concentrate on preventative measures. That's harder. That's a real challenge because that's about getting into conversations with other managers around the business, with our peers in the value chain, and really having some difficult conversations, really, to be able to get the level of integration that would be needed to be a fluid and adaptive system. So as I talked about earlier, so yeah, I would say primarily it would be shift your focus, shift onto being preventative rather than recovering.
Lovely, thank you. And like you say, our amazing health and safety profession has the skills to do that. Duncan, that just leaves me to say thank you again. That is a great session to end with. It's all about the people. That's what we need to do, is look after each other, look after our people. Wonderful last session. Just a reminder to everybody before we close this conference, all the sessions are recorded. You will be able to see them on demand and pick up all the valuable information that all of our speakers have given us today. Duncan, massive thank you from me again and from NEBOSH. And
my pleasure.
Good evening, everybody. I hope you've all had a great conference. Thank you.